connections. Hi, Supriya.
I
I hope my voice and everything is clear.
I hope I'm clear.
Yeah, it's completely clear. If you can just tilt a camera a little towards you.
Yeah, this is the stand I have got.
Okay.
First time I have come on a Insta live.
Right, right.
Uh,
No, but that's perfectly fine. We can see.
yeah.
So, welcome all the mommies. Let's begin our evening for today as we are doing our International Breastfeeding Week Series. And here with yet another very interesting topic, which we are going to talk about only food and food and food. So, today we are going to cover food that is important during breastfeeding and postpartum. To introduce my today's expert, I have with me a wellness consultant, certified clinical nutritionist, an ACSM certified personal trainer, and a co-author of book Traditional Recipes for Pregnancy and Motherhood. Please welcome Supriya Arun.
So good to be here and reach out to the mothers here who are eager to know more about the right facts about food during the this period, very critical period, where the mother's nutrition is the ultimate, that is the ultimate important thing during that time. And that is the time when also the family realizes how important they nourish the new mother. They give importance to what she eats.
Right.
And India, with its diverse communities and traditions, and different region, every 100 kilometers, what practice they follow is different. Like what kind of food they
Right.
give to their pregnant or a new mom is different, and it's very interesting to note that several traditions are still being followed through the country, and it is
Right.
very unique for India, I would say.
So, Supriya, before we go ahead, I don't think so much of the people know this thing, but you have a pharmaceutical background. So,
Yes.
what motivated you to move from pharmaceuticals to nutrients to a wellness consultant?
Yeah, so that's a very interesting journey, I would say. So I worked in Cipla initially, and then with Nicholas Piramal, I was in R&D. And I was always looking at, ways to attack a disease or any infection after it is coming. And it is, the thought always was there that we are not doing anything much to prevent it. Like, so much can be done to prevent it, and how do you prevent it is by developing your health and your immunity. And that is only through food. It hit me when I started preparing for my marathon. Like, I started running, and I couldn't find the right kind of information for me around as to what would be the right nutrition for me, what I should eat, what I should not eat. And so I just joined this certification just for my sake and for my family's sake. But that just pulled me inside, and and I found there was a lot of interconnections between so as a master's in pharmacy, you learn a lot about the body, and there are a lot of interconnections between that and food itself, and those things interested me. And that's how I came here.
Right. So, our expert Supriya, she really believes in improving the quality of life through nutrition and exercise. Her passion for fitness and her love for food, she keeps trying recipes and keep them giving a very healthy twist. In fact, she was one of the between tasty of BBC Good Food India magazine, right, ma'am?
Yeah, yeah, that magazine is no longer there, but they would send recipes for us to try
Right.
at home, and then we need to give them inputs on. So that used to excite me, because we used to get new recipes, and we can try and give our inputs on that.
Right. So as we are moving with the evening, we are in the International Breastfeeding Week. So I'll definitely like to discuss this different stages of a mother when the journey begins during the pregnancy, the breastfeeding, and later on. So the diet
Yeah.
plays a very important role.
Yeah, yeah, of course, because the entire baby inside the womb, the growth is dependent on what the mother is fed, like
Right.
what she eats, and also like the responsibility doesn't end there. Once the child is born, also till the child is weaned away from the breast milk, the entire responsibility is the mother's, and we all know how important breastfeeding is, like
Right.
so I don't have to emphasize on that. And so it's very important, therefore, to give the correct kind of nutrition to the mother, so that she'll be able to handle. So there's a lot of stress in the body, the mind, and there is sleep deprivation. So nutrition is one thing which we need to take care for this stressful period.
Definitely, ma'am. So let's start from the first stage only. What is the kind of diet that you suggest to a mother who's in in the final trimester? To
See, people actually, this is a very common belief that they say you have to eat for two. That is not right.
right,
That is not at all right, because actually, if you see, you just need to have 450 calories extra per day from what you were having pre-pregnancy. That's all.
okay,
It's just that in that 450 calories, you pack it with a lot of nutrition rich stuff instead of empty calories. See, a pack of rice will be just 300 calories. And that's about it. Like you have your two meals like that, and it is made, but it is not going to give you the nutrition. It is like how you pack those allowable amount of calories with a lot of rich foods. Rich, I mean, not ghee and sugar and like that. Rich in nutrients. And the last trimester, of course, iron is very important, protein is very important. That is because the maximum growth of the baby happens during that time. The blood is formed in the baby, the volume is developed. So these two, and of course other folic acid. So all these things are anyways the doctor takes care of by giving you supplements. But you can protein is one thing you need to take care through food. And apart from the supplements, iron-rich foods also is a important addition which the mother should take care.
so, ma'am, as soon as a mother delivers, her journey from cholesterol to breast milk, it may be easier for some of them, but for few of the mothers, it becomes a task. So, what food ingredients need to be added to their diet once they deliver the child to increase the milk supply?
Yeah. Okay. So the lactogenesis or the milk formation, it happens in 4 stages. The first stage actually happens before the child is even born, when the breast development takes place and all that. Second stage is when the child is born, but your breast is still getting ready for colostrum is being formed, but it is not full. The breast is not filling up, and so this period is the second stage, which takes about 2-3 days. That time you don't expect too much of milk, but you can start with a thin fenugreek water. Fenugreek is supposed to increase the lactation. So it's a very light lactation aid. So you just have boiled water with fenugreek seeds and meaty seeds, and you can keep sipping it. And then only after the first week, actually the third stage sets in. A third stage, when the breast actually becomes very full, and the full lactation period starts only after the first week. So that is the time when you can start on with other traditional lactation aids, which we usually take. The garlic is given. Yeah, of course, fenugreek is given, but in a need not be very dilute. You can give it in the form of methi laddus or something like that. In a more concentrated form, shatavari, moringa, all these things can be started after the first week.
Okay.
See, the thing is, like, there is no need to be harassed or stressed about the whole thing. It's a very natural process, and it is started by two important hormones are very important. One is of course, the prolactin, which is the hormone which increases, and the other one is oxytocin. Oxytocin also increases the the breast to develop more milk, but it is activated only by the suckling of the infant.
Right.
And so, even if the milk is not formed, don't get stressed. Allow the child to suckle, and that is actually going to increase your blood, lactation.
Right. Right. So also, ma'am, as once the mother delivers, so today it's a tradition that the moment the mother is delivering, they are always recommended with some kind of lactation medicine or support. So is it necessary for all the mothers to go on the medicines, or naturally, with natural food ingredients, they can increase the milk supply?
See, like previous generations, they used to have 8, 9 kids. And who was giving them any lactation aid capsules? And they didn't even have formula. Like if breastfeeding
Right.
fails, you have the formula now. Those things were also not available. So breastfeeding was the only option, and they managed with just foods, right?
Right.
So you don't. It's a very natural process, and you don't need, unless there are some real issues, which can deter the lactation process. But that is a very small percentage. It's not in the maximum population.
Okay, so moving on to the next one. Ma'am, what are galactogogues and what is the role that they play in our diet?
Yeah, galactogogues are foods which are known to increase the blood, lactation in the mother. It stimulates the hormone, either oxytocin, these two hormones I told you. So either the oxytocin or the prolactin, it stimulates. For example, it is proven clinically that moringa, shatavari, fenugreek actually increase the prolactin hormone, secretion of the prolactin hormone, and that's how it helps the mother to form more milk. So these are very traditional foods which are used not only in India. There are some galactogogues used abroad also, like fenugreek is used across the world. So these are things which help you. You can include in the diet. You don't have to have it as a separate thing. Just incorporate it in your diet, and you will see the effect.
Right. So, ma'am, it is always said that when the mother is feeding the child, even it affects the mother's nutritional status. So, is this true? And if yes, what is the category of food that she needs to add to balance the same?
So it is generally believed that even if the mother is malnourished, the child gets the nutrition it requires,
Right.
the basic nutrition it requires. But there are some things which the child, but of course, the quality of the breast milk depends on the quality of the mother's diet. That is definitely there. But generally, it is it is not, the child can survive and grow even if the mother is malnourished. But our intention is not that. Our intention is to, have all the nutrients as much as possible to get to the infant, right? So what we need to do is, so there are some nutrients which, if the mother is not taking enough, the milk anyway is, the body takes care to protect the infant. The milk is, having all the nutrients. It dips into the levels of the mother to make the milk as nutritious as possible for the infant.
Right.
So in that case, the mother lacks these things.
Okay.
For instance, iron and also protein. So the protein levels of the mother, the iron levels of the mother is taken advantage of, so that the child is not denied. So in that case, like that's why we need to nourish the mother, so that she doesn't, the infant is not affected in this case, but we need to take care of the mother. She should not fall short of it.
Right. So what are the things? What is the category that she should be adding up apart from iron?
Protein. Protein, she should be having at least 1.2 grams per kg. So if you weigh 50 kg, at least 1.2 times,
Protein.
that much protein you need to have. And that is very, important part of the diet. And apart from that, vitamin D, vitamin A, all these things
Right.
are very zinc. These are very important things which should be part of the mother's diet.
Right. Right. Okay. So, ma'am, what is the role of carbs in breastfeeding diet?
Yeah, carbs is very important in the sense that so the carbs what the mother has is only going to get converted to the lactose. The milk, obviously, the breast milk is full of lactose and other nutrients, of course. So the carb in the mother's diet is important in that sense. But if you ask what kind of carbs, I would say she should be having complex carbs. Just because carbs is so she can't be having a lot of sugar because that is going to be increasing the insulin levels, right? So it has to be a good choice of carbs she should be having. And having said that, there are few who are very conscious of their weight, so they cut the carbs even during breastfeeding. Cut the carbs in the sense I'm saying you need to have that much whatever is required for you. You should not go beyond below that level,
Right.
and you should not go overboard also. So a balance needs to be there. But carbs is a good thing for a feeding mother.
Okay. Okay. So, there is a mother who she's asking, my breast is soft but leaking. I'm not sure I have enough milk.
Yeah, so this is, if the child is satisfied, is able to, is not, after the feed, the child is going to sleep and, is not very finicky or crying or anything like that, and the weight gain is proper, then you don't have to worry about it, like how your
Right.
breast is like. So the child growth is there, so that means enough milk is there, so you don't have to bother about it.
So next question is how drinking water improves breastfeeding.
Yeah, that is one of the most underrated thing, water, because what they say is hydration and the mother, the child suckling are two important things for the mother to produce good amount of milk. And these two things, and the mother has to drink at least 12 glasses of water. So I would say, instead of keeping a count of those things, after every feed, drink a huge glass of water. That will take care of, keep a glass of water by your side. After every feed, you have a glass of water that will take care of your requirements.
So, ma'am, as in today's time, when you were talking about mother-in-law, they all were around, and the traditional things that
Yeah.
that these people do after the delivery with the for the mother. So now,
Yeah.
because of the pandemic around, there are many moms who are alone at home, and there are a lot of
Hmm.
supplements or maybe products available in the market which are natural. So, how much we can trust these products?
Yeah, you need to read the label
Right.
and see, if there are any additives, added sugar, added things. So you need to read the label and make a good judgment for yourself. I would say, see, those are all convenient thing. Like if you're going out somewhere, if you want to go do something, then you can take some available natural, like close to natural thing that is available in the market along with you, instead of not having something. But if you're at home, if there is somebody to make and give you, then why not make fresh thing with those ingredients and have it.
So there's this mother, she's asking, what is the right time to start milk bottling for baby?
So that is a lactation expert's
Yes, that's
question
a
actually.
lactation expert's
So
question.
yeah, so because
So,
they say you can feed till 2 years.
right,
So
right. So to all the
Yeah.
mothers who are asking us questions related to baby feeding and the milk and lactation, we will be coming up live day after tomorrow with Miss Ifat Yashmi, lactation consultant. We can take up all your questions day after tomorrow. Okay, so coming back to you, ma'am. Uh, as this session, like last 3 days, I'm simply doing question and answers. So today, I actually
Yeah.
wanted to do a little different session with you. So,
Yeah, sure.
as we all know, the postpartum phase is the most confusing one for both mom and baby when it comes for healthy diet and nutrition. So, I have divided this postpartum phase into two parts where I have picked up some of the issues which a mother face, and I have picked up some of the ingredients which a mother needs to add in her diet. To
Okay.
start with the first part, I will be giving you one issue that a mother faced, and you please help us to know how can very naturally, from a very natural way, they can come, they can help themselves.
Yeah, yeah, sure, sure.
So, going ahead, my first is low hemoglobin levels.
Low hemoglobin levels, yeah, I told you iron is the most important thing which the mother should take care in her diet. Of course, doctors give iron supplementation, but apart from that, you should be having lot of iron-rich foods. Iron-rich foods I can name, include beetroot every other day. Then our olive seeds laddu, which is part of the Maharashtrian tradition for breastfeeding moms. The olive che laddu, the halim seed, the garden seed, garden cress seeds. It's the one of the highest sources of iron we have.
Okay.
One of the superfoods I have included in our book, the traditional recipes, is turkey berries or the Thai brinjal, which is put in, it is available as Thai brinjal in the supermarkets. You put it in the Thai curry, green Thai curry, and all that. So that is quite high in iron, one of the richest sources of iron. Your poha is high in iron. So, includes these foods which are known sources of high amount of iron in a regular basis. Include at least one of them daily.
So, ma'am, there are mothers who face low sugar issues. Their blood
Yeah,
sugar
the
goes
low
low.
sugar. Yeah. So low sugar is because, see, after all, the lactose that is there in the breast milk is derived from the sugar of the mother, right? And usually low sugar doesn't happen. The mother is able to, manage if she's having a proper balanced, regular food routine. But some people have these issues. So what the ideal thing is to have something like immediately after the feed, have some water and have some kanji. So my mother used to give me after every feed. She used to keep this kanji ready, either rava or ragi or something. So which is a very good carb, and add milk to it, and then she used to give me after feed. So it absorbs a lot of water, so it's watery. At least 2 glasses if you have it, also provides you with the water for the next feed. So you need to keep track of how you are your routine is, food routine is. So if you're feeling low, then have something immediately.
Okay. So next one is low milk supply.
Yeah, low milk supply is, see, generally it is not a problem. It may be something to do with the latching of the baby. As I told you, like the suckling of the baby is very important for the milk production. Maybe the baby is not suckling properly.
Okay.
So you need to address this, ask an lactation expert, and, ask them what is the problem. If suckling is okay, but your milk is not a thing, then it could be any of the thing like if insulin resistance is there, if they were the mother, they have been instances where gestational diabetes mother has had issues with feeding. So there has been a link established between low glucose tolerance and lactation issues. but it can be sorted out with the help of a lactation expert. So what a mother has to do is eat all the foods, necessary foods she has to, include some galactagogues, natural galactagogues, and it should work unless there are issues like this, problems like this, like latching issue or something like that. Yasmin would be able to tell you if the child is not able to suck due to the what she calls as the in some problems in the mouth, so tongue tie, she says.
Right.
So so those kind of issues. So rule out those things. It is never a problem of a mother not being able to produce enough milk. Some issue will be there.
Okay, so ma'am, next one is low energy level.
Yeah, low energy level is usually seen because of iron is low, number one. Or two, it is like, the sleep cycle is not okay. The mother has not had a proper sleep or rested properly, because the baby is waking up or the baby is colic or something like that. Or it could be also postpartum depression. So the mother should be able to, realize that she's going through this low period and, and address it with the help of a good support system.
Right. Ma'am, recovery from C-section.
Yeah, so it has become as normal as a normal delivery. So recovery is, if it is a full anesthesia, you are back to normal immediately. If it is a spinal, you may have some pain in the back. But doctors usually give some back exercises, some exercises to do, and start that. Like after 10 days, you can start doing it. Like lying down, there are lots of exercises which you can start doing. Do that and have an active lifestyle. Especially after, just because you've had a C-section, it doesn't mean that you can't do anything. You can't lift weights for some time, but you can always have a very active lifestyle. Go for a small walk. Those kind of things you can start incorporating, within that 1 month itself.
So what should be added to the diet for quick recovery? Apart from exercise?
There's nothing different from normal.
Right.
Yeah, there is nothing different. You recover similarly, not much of a difference.
How about immunity boosters?
Yeah, so you take care that. So one of the things is vitamin D, as I told you. So be vigilant of your vitamin D levels. And it is also important for your breastfeeding. So, and vitamin D is very important for your immunity, as we all know, everywhere we read that. Zinc, vitamin D, and iron. These three are very important for your immunity and as well as protein. So when the protein demands of a breastfeeding mother is very high. So if it is very low, if you're not eating enough protein, then you may fall sick often. So be very prudent to include good protein sources in your diet.
Okay.
And you won't fall sick.
Not for bone health.
Yeah, for bone health, calcium. So calcium is another thing which the milk, the infant's milk is, has the calcium. It derives from the stores of the mother. So if the mother is not replenishing, so her stores are going to be lower, and that's when bone loss happens. So, the requirement of a breastfeeding mother, daily requirement of calcium is around 1,200 milligrams. Usually a 500 milligram or a 1,000 milligram tablet is prescribed. Apart from that, include a lot of calcium-rich foods. Ragi is so rich in calcium. So ragi can be included, and you can include makna in your diet. Then lotus stem can be included. Poppy seeds can be included. Posto has a lot of poppy seeds. There's also, poppy seeds, kheer is also made. Right. So our traditional foods takes care of everything, if you see, So any of these you see, it will be part of the postpartum diet in one of the regions of India. So there's a lot of traditional wisdom out there.
Okay. So, ma'am, moving on, there are a lot of mothers who faces gut issues and constipations. So, what will you
Yeah.
suggest for gut health?
For gut health, what I would suggest is have a lot of this uh, not daily, but at least once or twice a week, you can have this fermented what is the kanji, which kanji vada has this fermented thing, or you can have a little kombucha. Drink around 30 ml of kombucha, which is going to increase your, and have a lot of these probiotic curd. Curd is probiotic. Have curd, include curd in your. So there are lots of these natural things which you can add in your diet to,
Right.
and fiber, like include fruits with the skin. Like apple, don't peel the skin, have it with the skin. Then automatically, when the fiber increases, your constipation is going to be taken care of.
Also, there are a lot of mothers who faces a lot of issues with their hair and skin post delivery.
Yeah, so this doesn't happen in the first 3 months,
Okay.
because your anyways iron and protein is the most important thing for hair doesn't hair fall, and for the skin also to glow, it is the protein which is important, and you usually taking care of in the first 3 months. There you are also everybody is taking care of the new mother. You are also very conscious and eating all those things. But usually, what happens is after 3 months, when the child starts moving, your schedule goes for a toss, and you're not paying so much attention to your food intake. That is when the third month onwards the hair fall starts happening. So what the iron level? So you don't stop your iron medication after 3 months. Let it continue for 6 months. So this is one thing which I always see. For 3 months they are very. So they start some some semi-solid food for the child, and so they don't they get some relief from breast. They say I'm not fully breastfeeding, so I have reduced my iron. People tend to do that. So continue with those things, because it is very important for your
Right.
skin and hair. Hair fall is a problem after third month. I have seen this in quite a few mothers.
So, in short, iron plays a big role in everything.
Yeah, 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 sure.
Iron, protein, and everything. You should always keep your diet filled with iron and protein stuff.
Yes, yes, that is there.
So, ma'am, as I can see, one of the mothers has shared a question: do we have to give breast massage during pregnancy, and will that help feeding after pregnancy?
So that is also a lactation
Lactation
expert's question.
yes, yes. So I request all the mommies, if you have any diet related questions, anything you want to know about any of the ingredients or food, please do share your questions in comment box. So now moving on to the second part of this show, as we all know the power of Indian superfoods and ingredients that are there in our kitchen, they can create
Mm.
miracle, at least
Yeah.
for the mom who are breastfeeding and post delivery also. And happy to say these are part of also product lactobites. So I would like to pick up one in one ingredient, ma'am. Please tell us in exactly what is that ingredient rich in. So I'll start with the first one, and a very favorite one in every Indian kitchen post delivery is ghee.
Yeah. So ghee is ghee is included, saying that you need as I said, like you need to eat for two people
Right.
now that you are breastfeeding. So that is not the case. It is quite high in calories. So you can have ghee. I'm not saying it is bad, but you need to have a limit to it. Because in the first 6 months, you need to have only 350 kilocalories extra from what you were having before pregnancy. Only that much. So, but actually, how much you will be spending is so some calculations here. It will be interesting for you to know. So, for 100 ml of milk, breast milk, which the mother produces, she burns 85 calories. Ah. So, for a normal breastfeeding mother, she'll be producing around 750 ml of breast milk daily.
Right.
So when you calculate, it comes to around 600 calories.
Yes.
The mother burns every day. She is breastfeeding in a normal level
Right.
for an average mother. So your outgo is 600 calories. But what the nutrition experts say is you just need 350 calories extra, and rest of the from the but you're spending 600, right? You may ask me. So the rest of that thing is coming by burning the nutrients in the mother, the fat in the mother. The rest of the calories is going to be that is going to be produced from the fat of the mother. That's how the mother can get back to shape. So people don't understand. They eat a lot, and that's why they gain weight. So what they require is slightly lower than what they spend, so that the body dips into its own fat reserves, and you get back to shape after that 6 months.
Right. Okay.
So ghee is, but I'm not against ghee because it's a very good medium. It's a all fat soluble vitamins, vitamin D, vitamin A, which is very important. It is rich in that, and it's a medium for absorption. So I'm not saying you completely do away with, but keep these calorie conscious mind, and go low on it.
Okay. So I'm coming again. The favorite of Indian kitchen, haldi.
Yeah, haldi,
Turmeric.
yeah, undeniably important, ingredient because of its anti-inflammatory, antibacterial properties, and it's of course, included anyways in your diet. But in our book, we also have a haldi laddu, which is prepared in Rajasthan, which is made only with the haldi, the actual wet haldi, and it's delicious. So if you want to include a higher amount, you can, have some things like this, where you get a higher dose of turmeric.
Jeera.
Yeah, jeera is high in calcium. Coriander and jeera is very high in calcium. And I told you, like, I can't emphasize enough of how important calcium is. And apart from that, it is also a very good digestive, and that is going to help in so that the mother doesn't develop any bloating, because any uneasiness in the mother is transferred to the child can become colic, and so it helps in the digestion,
Right.
better digestion. Yeah.
Okay. So next one is fennel.
Fennel, again, the same thing. Fennel is high in protein. You'll be surprised to know that. Apart from that, it also has a lot of digestive properties. It is also sometimes classified as a galactagogue. Galactagogue, it is not exactly like it's not as powerful as a fenugreek or a moringa or a shatavari in improving the
Milk supplement.
lactation, the breast milk supply, but it has some effect.
Right. Ma'am, amaranth.
Yeah, amaranth is a gluten free grain and seed actually, and it is also very rich in zinc and protein, and everybody should include it in the food. Like, but if you see a lot of these traditional laddus, they don't use wheat; they use amaranth. It's just fried and sautéed and added to the laddus. So amaranth is part of our traditional, post childbirth meals. It's very much part of our traditional meals.
Right.
Yeah.
Ma'am, pumpkin seeds.
The pumpkin seeds, are rich in good fats, and also rich in zinc. All these seeds and nuts are very good sources of zinc. And I told you how it is important to have a meal which is rich in zinc also, because your immunity is also of utmost importance during this period.
Okay, so moving on is green leafy vegetables.
Yeah, it should be part of your, a diet during this period, and it need not be daily, but twice or thrice a week. Because it also green leafy vegetables, apart from being rich in iron and calcium, it also has some anti-nutrients called phytic acid. So it prevents it from absorbing other minerals from the other sources of food. So don't, no need to go overboard on it. Like you can have it twice or thrice in a week.
So as you have mentioned so many times, importance of iron, I'll not forget this one particular category, that is dates.
Yeah, very rich in iron, and it is also a natural sweetener. So a lot of these laddus and all, they use dry fruits instead of adding simple sugars. The advantage of adding this is, like, apart from adding sweetness, of course, it is not sugar free. It has its sugar, but the sugar levels are not going to rise very, there's not going to be a sharp rise. It's going to be muted because it is high in fiber also. So the body process it very slowly, so it is not going to give a spike. So that is the advantage.
So even if a mother has just recovered, or she has gone through gestational diabetes, she can have dates in her diet.
So how much is what is very important, and what she has it with.
Right.
So if she has it with some fatty element like nuts or something like that, just one date, and just after a feed, when she is actually craving for calories, when the body will take up all the sugars, that is the time to have it. Not, as a dessert after a meal when already your sugar is high.
Right.
So there's a time to have it. So if you want the iron and the good qualities of dates, then you need to time it accordingly.
So one of the mother is asking how much intake of pumpkin seed is good for a day. I used pumpkin seeds. I had a little sinus issues.
Yeah, so some people are, sensitive to this nuts and seeds. What I would say is you can soak the seeds overnight, and that removes these phytic acids and other anti-nutrients present on the surface, and also improves the digestion, like you're able to assimilate it better, and the side effects are reduced.
Okay, so moving on, as we are done with all our ingredients, there are, so this is a very well proven phrase. I believe healing starts in our home, and more specifically in our kitchen. So moving on as well, there are a lot of myths and conceptions which it comes to breastfeeding, to postpartum. Some people says you should be eating this, some says no, this is not good. So I've just made a gist of myths and facts for you. So I'll take one
Yeah,
by
sure.
one, and let's see, as a nutritionist, what you have to say about those diet related facts. The
Yeah.
first one is eating kgs of ghee will strengthen your joints after delivery.
As I told you, no, it is a myth. So it has nothing to do with the joints as such. Maybe this has come into play because, as I told you, it is a good medium for fat soluble vitamins like vitamin D, which is again important for calcium absorption. So that could be the reason, but that doesn't mean you always have to have a level. You should not go overboard.
Right. Next one is drinking cold water post delivery slow downs your recovery.
It has
That's a myth.
nothing. But generally, so in Ayurveda, if you see our traditional wisdom, it says like you have to drink the water in close to the body temperature, slightly warm it and have it. So the body is not shocked. So maybe that is where it comes from, that the body is already in a stress state, so you don't shock the body by altering the temperature suddenly. Some people can take it. Some people who are prone to sinus will not take it. They just fall sick even by having half a glass of cold water. So those people should avoid anyways. So I can't make it a general rule that you should not have it. Some people don't have any issues at all. I don't think why this. Yeah. It is
So,
not a
so we'll take that as a win.
yeah,
Okay.
yeah.
So the next one is if you are a vegan mom, you'll always face a low milk supply.
No, that is not true. But I would suggest that unless there is a actually health problem associated with it, you need to while breastfeeding, if it is just for your, your belief, or you've started being a vegan, for the child's sake, if you can, be give up your veganism for 6 months, that would be good. I'll tell you why. Because as I told you, calcium is so important, protein is so important, and the milk is a very easy way of increasing both.
Right.
You just have a glass of milk and you get 4 grams, 5 grams of protein, and it is a complete protein, and highly absorbable protein, and also calcium. And it is a complete, it also has lactose. It's a complete meal. So it's an easy option for you. Whereas in veganism, then to substitute that, you need to think a lot about it. So, but if you are very firm that you will continue with your veganism, I would suggest you approach a nutritionist. Get your thing designed so that you don't fall short of. So another thing is vitamin B12 also, which is only in animal products. Unless it is a fermented product, other things are all milk, eggs, cheese, all these things, and meat. All these things only have vitamin B12, which is very, very important. And you're losing that. And milk has all these three: calcium, protein, and vitamin B12. So if you're not having it for vegan diet, you please get a well-designed plan for yourself so that you meet these needs. Just don't operate by yourself, like saying, I will cut milk, but I will still breastfeed. So, that is not going to work.
So taking up the last question for the evening, one of the mother has asked, having carbs, that is specifically rice, twice a day during pregnancy will cause gestational diabetes.
No, it's nothing like that. It's dependent on how well you process. So if you already have insulin resistance, then it's going to be a problem. Because it is all said and done, white rice is going to increase your, blood sugar levels very high. And already during pregnancy, a person, the glucose tolerance is less. That's why it shows up. So for these insulin resistant people, like gestational diabetes, they have that, and once the child is born, they are back to normal because they are able to tolerate the glucose in a better way.
Right.
Pregnancy increases the resistance. So in that case, when it is already high, then when you are having it is a problem. So if you are having high insulin resistance, how do you find it out? So there is a test called HOMA-IR which you do, which will tell you like how insulin resistant you are. So if you are in a normal scale, then you can have normal rice. There is no issue about it. But if you are highly insulin resistant, then you switch to a brown rice or millets or something which is not going to increase your blood sugar to such a high level.
So after all the discussion, myths and facts, there is one thing which is very clear, that we do not need to focus on how much we are eating. So more important is what we are eating.
Yes, exactly. Yes.
So food is a medicine. So we can just go in our kitchen and pick up our right prescription. and start eating and changing our diet right from today. I'm sure all the information that Supriya has shared with us has helped all our mothers. Thank you so much, Supriya, for coming to our show and throwing light on so many important ingredients and topics, which are the
It
basic
was my
ingredients from our kitchen.
totally my pleasure, and thanks for giving me this platform to reach out to the mothers. And I'm so happy I'm able to help out if I'm able to
Thank
clarify some of the doubts.
Thank
Thank you
you
so
so
much.
much. Thank you, mommies, for joining us today. See you all tomorrow with our next expert, Dr. Manjula Anagani, at 6 o'clock with the topic How Baby and Your Breast Grows During Pregnancy. Thank you so
Thank you.
much. Have a nice evening.